So the next topic is talking about accessibility of healthcare services in India. So why are we discussing about accessibility of healthcare services in India is because of household consumption survey. Household consumption So the next topic is talking about accessibility of healthcare services in India. So why are we discussing about accessibility of healthcare services in India is because of household consumption survey. Household consumption expenditure survey of 22-23 has come out. The report has come out. Okay? So we will be assessing about what has the report told, but it has also spoken about this entire assessment is only about the bottom 50% of the population. Assessment of bottom 50% of the population, it says कि quantifying household, how has been the assessment carried out, how have we calculated कि आपका consumption expenditure कैसा रहा है related to, and this specifically will be related to, all of this discussion will be related to healthcare services only. ठीक है? So quantifying households in case of adverse medical shocks. Adverse medical shocks matlab it can be hospitalization, any kind of hospitalization. Say if a family has faced some kind of adverse medical shock, what has been the household expenditure or household consumption? Secondly, measuring the vulnerability, that is monthly household expenditure in healthcare facility. What was your last month ka healthcare expenditure? That will help us analyze the vulnerability. Why vulnerability? Because for example, last month some family has invested some 5,000 rupees or 10,000 rupees in healthcare services. Okay? So that means this family is much more vulnerable than those family who has last month invested only 500 rupees for health services. So what has been your previous month ka healthcare consumption will ultimately help us determine how vulnerable this particular family or this particular population is. So this has also added up or helped us in calculating the household consumption expenditure. And thirdly, how have we assessed under this survey is we have compared the households, okay, spending with and without the medical cost. So the medical cost, what has been your medical cost of last month? Okay? So let's say it was 7,000 rupees for a particular month, it was 7,000 rupees. So this is with the medical cost. So in that case, if 7,000 rupees was your medical investment, so how much was your personal disposable income which was left with you? Plus, we are comparing this situation to another situation. If let's say your last month ka healthcare expenditure was 700 rupees, so what is your personal disposable income? Obviously, in second case, your personal disposable income increases. So if your personal disposable income increases, that means we will be able to, by investing in healthcare services, we will be able to reduce your expenditure, common people's expenditure in healthcare services, and ultimately allow them to increase their personal disposable income, which will help them to come out of the poverty. ठीक है? इसलिए इस तरीके का assessment required होता है, because it will help us to analyze the government failure or the policy failure because of which people had to invest heavily in their healthcare services and which ultimately led to a situation wherein their personal disposable income was reduced. अब उनके हाथ में इनकम नहीं है तो they do not have the option of increased savings, increased investment, better education, better healthcare facilities, and they enter into the poverty trap. ठीक है? So what are the findings of the household consumption expenditure survey? ठीक है? Talking about the accessibility of population accessing the hospital services. The percentage of population which is facing hospitalization, this was only 17% in 2011-12. ठीक है? सिर्फ 17% of the population was accepting hospitalization. You can call it because of lack of access to hospitals. ठीक है? But this has increased to 22%. This has increased to 22%. मतलब hospitals ही बढ़ गए. Hospital बढ़ गए. That is why people were able to get hospitalized. ठीक है? So this is one thing that the survey has reported. Rural areas में hospitalization has also increased. But otherwise, if you see, rural areas में usually they don't accept hospitalization itself. बट रूरल एरियाज में भी 18% पॉपुलेशन 2011-12 में हॉस्पिटलाइज होती थी, ठीक है, which has increased to 23% in 22-23. Urban areas में 16% was initially in 2011-12 16% of the population was going for urban hospitalization, which has increased to 20%. Now we can also come to this question कि क्यों urban area में कम hospitalization हो रहा है, why in rural areas more hospitalization is taking place, because obviously the overall expenditure or health facilities or a better lifestyle, better food, better immunity can be obtained in an urban area, which is not the case in rural area, ठीक है. So इसलिए भी ये कम opt करते हैं hospitalization because they are much more immune, much more stronger as compared to rural area. Immunity itself is low because of lack of food or better availability of food, ठीक है. So this was accessibility. Second is affordability. Talking about what does the expenditure survey say, talking about affordability. Now without hospitalization, if the hospitalization doesn't take place, the share of health expenses has increased from 3.3% to 3.6%. ये रूरल एरिया में भी है, अर्बन एरिया में भी है. इसका मतलब ओवरऑल हेल्थ एक्सपेंसेस एक्सपेंडिचर हैज इंक्रीज फ्रॉम 3.6% टू 3.3% टू 3.6% अगर हॉस्पिटलाइजेशन को काउंट नहीं किया जाए. बट अगर हॉस्पिटलाइजेशन को काउंट कर लिया जाता है, इफ वी काउंट हॉस्पिटलाइजेशन, then the share of health expenses has actually decreased from 10.8% to 9.4%. Now what does this survey mean? What does this data mean? ठीक है, कि अगर हॉस्पिटलाइजेशन नहीं हो रहा है, इसका मतलब कोई सेकेंडरी एंड टर्शियरी केयर इज नॉट रिक्वायर्ड, तो ओपीडी केयर में पीपल हैव स्टार्टेड विजिटिंग हॉस्पिटल्स मोर, ठीक है. बट अगर हेल्थ एक्सपेंसेस की बात की जाए, इफ यू आर टॉकिंग अबाउट सेकेंडरी एंड टर्शियरी केयर, तो उनका हेल्थ एक्सपेंसेस कम हो गया है. व्हाई इट हैज डिक्रीज इज बिकॉज ऑफ सक्सेस ऑफ द स्कीम कॉल्ड प्रधानमंत्री जन आरोग्य योजना. दिस इज वन ऑफ द स्कीम, प्रधानमंत्री आयुष्मान भारत स्कीम, which talks about secondary and tertiary care में cashless services, health insurance cashless services will be provided. ये मदद किया इस population को. This has helped this population कि उनका health care expenditure कम हो जाए. If hospitalization include कर लेते हैं तो इनका overall health expenditure कम हो जाता है. अगर hospitalization नहीं include किया जाए तो इनका health expenditure बढ़ जाएगा, ठीक है. So this is talking about a positive indication कि पब्लिक के लिए अब हेल्थ केयर सर्विसेज हैव रिलेटिवली बिकम अफोर्डेबल, ठीक है. प्लस टॉकिंग अबाउट चेंज इन कंजम्पशन स्टेटस, आउट ऑफ द 50% हाउसहोल्ड्स, 50% हाउसहोल्ड मतलब बिकॉज वी वर टॉकिंग अबाउट बॉटम 50% ओनली, रिमेंबर. तो इनका कंजम्पशन स्टेटस कैसे चेंज किया है? पहली बात कि 40% विटनेस्ड डिक्लाइन इन कंजम्पशन ड्यू टू हॉस्पिटलाइजेशन. अगर 2011-12 की बात की जाए तो अगर इन 2011-12 फैमिली में वन ऑफ द मेंबर गेट्स हॉस्पिटलाइज्ड, तो 40% पॉपुलेशन ऐसी हो रही थी दैट दे हैव विटनेस्ड अ डिक्लाइन इन कंजम्पशन, ठीक है. 2011-12 में इफ वन ऑफ द फैमिली मेंबर गेट्स हॉस्पिटलाइज्ड, ठीक है, तो 40% ऑफ सच पॉपुलेशन वाज विटनेसिंग अ डिक्लाइन इन कंजम्पशन बिकॉज समबडी इन देयर फैमिली गॉट हॉस्पिटलाइज्ड. बट 2022-23 की बात की जाए तो only 33% are such population which have witnessed a decline in consumption. That means poverty has reduced in the country. That means अब इनके फैमिली में अभी 22-23 की बात की जाए, so if somebody is getting hospitalized, ठीक है, तो 33% of such population are existing which are witnessing a decline in consumption because of hospitalization, because somebody in their family got hospitalized, ठीक है. So this is what the survey says. Now talking about the status of healthcare expenditure in India, ठीक है. This is a major problem, one of the biggest problem in healthcare services, and this was one of the principal reason for introduction of प्रधानमंत्री जन आरोग्य योजना और प्रधानमंत्री आयुष्मान भारत कार्ड कि इंडिया में आउट ऑफ पॉकेट एक्सपेंडिचर हैज बीन क्वाइट हाई. आउट ऑफ पॉकेट एक्सपेंडिचर का मतलब क्या होता है कि when you have been to hospital, ठीक है, you had to immediately pay to the doctor. ना ये इंश्योरेंस के बाहर की चीज है, that you मतलब this is what happens most commonly, that if you have been to hospital you pay to the doctor immediately, ठीक है, until and unless you have an health insurance you have to pay to the doctor immediately. So this we call as out of pocket expenditure because this was not expected in your normal budget expenditure. It was not expected for a family to witness that, but they had to do this. तो ये इंडिया में बहुत ज्यादा है. टॉकिंग अबाउट 47% of the total medical spending is coming from directly from pocket. For example, एक family pays है 100 rupee for in one family per family member they are spending 100 rupee. ठीक है, for a quarter they are let's say spending 100 rupee, hypothetical number of course, कि 100 ही रुपए ये लोग हेल्थ केयर सर्विसेज के लिए देंगे, बट ये 100 रुपए में ऑलमोस्ट 50%, 47% अप्रोक्सीमेटली whose total medical spending is coming from pocket. इसका मतलब ये 100 रुपए जो वो खर्च किए उसमें 50 रुपए उनके पॉकेट से ही निकला था इमीडिएटली. ठीक है, सो हमारे यहाँ पे दिस इज अ प्रिवेलेंट प्रॉब्लम दैट इंडिया हैज हाई आउट ऑफ पॉकेट एक्सपेंडिचर. द सेकंड प्रॉब्लम इज वेरी लो गवर्नमेंट एक्सपेंडिचर. This is 2.1% and this 2.1% is also the increased amount. ये पहले अभी 2-3 years back ही 1.6% के आसपास था. ठीक है, so government expenditure in healthcare services has been quite low, very low to 2.1%, and this is also the increased amount. The National Family Health Survey or the National Health Policy also, National Health Policy which came in 2017 और फैमिली हेल्थ सर्वे जो 22 ये डेटा निकालती है, ये 22 में भी ये बोल रही थी कि गवर्नमेंट शुड इंक्रीज द हेल्थ रिलेटेड एक्सपेंडिचर एंड ब्रिंग इट अप टू 3% के आसपास हमारी सरकार इन्वेस्ट करनी चाहिए हेल्थ सेक्टर में. ठीक है, देन टॉकिंग अबाउट हाई रेट ऑफ इन्फ्लेशन. ठीक है, हाई रेट ऑफ हेल्थ केयर इन्फ्लेशन एज कंपेयर टू 2011-12 के लेवल से 9.6% इन्फ्लेशन विटनेस किया है. ठीक है, हेल्थ केयर सेक्टर हैज विटनेस्ड एन इन्फ्लेशन ऑफ 9.6% फ्रॉम 2011-12. ठीक है, इन 2023 एंड वी आर एक्सपेक्टिंग दैट इट विल इंक्रीज अप टू 11% इन 2024. ठीक है, प्लस लो हेल्थ केयर कवरेज कि वी डू हैव, अब तो हमारे पास आयुष्मान भारत के तहत वी आर गिविंग cashless health insurance services to a majority chunk of the population, but सेंट्रल गवर्नमेंट के हेल्थ इंश्योरेंस स्कीम के अलावा भी स्टेट गवर्नमेंट आल्सो रन्स इट्स ओन हेल्थ इंश्योरेंस स्कीम. नाउ सेंट्रल प्लस स्टेट गवर्नमेंट इंक्लूसिव we are able to insure only 70% of the population. That means 30% of the population which is residing in India, living in India, are still not having any health insurance, or इनका out of pocket expenditure will push them into poverty. ठीक है, so this is the status of healthcare expenditure. Now talking about something else about the statistics, share of government expenditure in total healthcare expenditure. ठीक है, share of government expenditure, for example if a family is spending ₹100 for healthcare expenditure, इसमें सरकार कितना दे रही है, how much is government giving? They were giving only 28%, that is 28 rupee out of 100 rupee, only 28 rupee they were giving in 2013-14, but this has increased to 40.6 rupee in 2018-19. मतलब if an individual is investing 100 rupee in healthcare services of this individual, इसमें से 40 rupee is coming from the government. ठीक है, plus there is significant decline in out of pocket expenditure. This was 64% in 2013-14, 64% था, ये 39.4 which is approximately 40% in 2021-22 has been observed. ठीक है, now what are the challenges in reducing the healthcare accessibility, affordability specifically, healthcare को affordable बनाने में what are the challenges that India is witnessing? ठीक है, so first is the vested interest of private industry. India में healthcare services में 2/3 contribution private sector का होता है. Private industry is responsible for 2/3 of the healthcare services which is provided in India. गवर्नमेंट हॉस्पिटल्स और ये जितने भी गवर्नमेंट हॉस्पिटल्स आप देख रहे हो, प्लस सो मेनी पेशेंट्स एंटरिंग इनटू गवर्नमेंट हॉस्पिटल्स आर प्रोवाइडिंग ओनली 1/3 ऑफ द सर्विसेज. 1/3 of the population is being catered by the public hospitals. 2/3 of the population is being catered by the private hospitals. तो प्राइवेट हॉस्पिटल्स अपने आप को रेगुलेट नहीं करना चाहते. They don't want any price cap mechanism by government, and for this they have a very strong nexus with industry, healthcare industry, with politicians. There is very strong nexus between private healthcare industry and politicians, because of which they are not able to cap. The government is not able to apply the capping. जैसे गवर्नमेंट हॉस्पिटल में आप जाइएगा तो for something such as one of the examples that you will see here also, in cataract surgery, it takes maximum of 10,000 rupees for a government hospital. But a private hospital has charged for a cataract surgery as high as 1,40,000 also. Okay? Now, how is this possible? Is because private sector, private healthcare industry is not regulated very much. On the other hand, public sector or the government hospitals are obviously highly regulated. Okay? So, private health industry, they have a nexus with politicians to ensure that there is no capping on the price. Okay? There are so many political investments in private healthcare industry itself. There are so many politicians who have stakes in the private healthcare industry companies. Okay? Second major challenge is non-applicability of cashless everywhere scheme of general insurance. General insurance scheme claims that this will be a cashless health insurance services. But not every healthcare facility allows cashless services. Okay? So we do have, there is resistance of private healthcare industry which does not permit or which does not allow free cashless services, which does not allow cashless services, and lack of standardized treatment rates. Treatment rates is also very much unequal across the country because health is a state subject. So every state governs its own principles and determines its own treatment rates, okay? And that varies across all the states. So this cashless everywhere is not applicable itself, okay? Basically, ये जो general insurance schemes that including the Pradhan Mantri Ayushman Bharat card, which allows public and private hospitals in दोनों में ही secondary and tertiary care for BPL population can be provided, और इसके लिए health insurance का premium amount will be paid by the government, ठीक है? Now, because the government is claiming this is a cashless services, you carry a Ayushman Bharat card, swipe this card and your money will be credited, the insurance money will be taken and it will be deposited in the healthcare facilities account, ठीक है? बट बहुत सारे ऐसे फैसिलिटीज होते हैं, हेल्थ केयर फैसिलिटीज होते हैं जो कैशलेस सर्विसेज नहीं एक्सेप्ट करती हैं, और इसमें कौन कौन आते हैं? मेजॉरिटी ऑफ द प्राइवेट सेक्टर, या फिर इसको इंप्लीमेंट करने में ये प्रॉब्लम भी हो जाता है कि देयर इज नो स्टैंडर्डाइज्ड ट्रीटमेंट रेट्स. एवरी हेल्थ केयर फैसिलिटी हैज अ डिफरेंट चार्ज फॉर अ पर्टिकुलर हेल्थ केयर सर्विसेज. तो इसका मतलब यू कैन नॉट यूनिफॉर्मलाइज कि इफ आई एम स्वाइपिंग अ कार्ड दिस मच ओनली अमाउंट विल बी डिडक्टेड. दिस इज नॉट डिटरमाइंड because the healthcare facility may change the price. Okay? So we are not able to implement this. Third problem is high cost of treatment in private hospitals. For example, cataract, as we discussed, cataract surgery costs only 10,000 rupees in a government hospital, but 1.4 lakhs or 1,40,000 has been the charge of cataract service surgery in private facility in India. Okay? Then low healthcare expenditure. Low healthcare expenditure by the government, as we discussed, it is currently 2.1%. 2.1% of the GDP we are investing, government is investing in health services. As compared to China, which is 3.3%, or Thailand, which is 2.7%. तो इन सबसे भी कम हैं हम लोग, ठीक है? Next challenge is non-implementation of clinical establishment rules. Now, clinical establishment rules जो थे, ये 2010 में आए थे, ठीक है, and which was saying कि we will be nationalizing or standardizing the treatment rates, ठीक है, और ये state government के consent से ही होगा, obviously because it is a state subject, health is a state subject. So notification of standard rate of treatment in consultation with state was one of the primary intentions of Clinical Establishment Act. अब ये सारा issue इसलिए उठा क्योंकि there was one of the PIL which was filed in Supreme Court stating कि the healthcare services in India, especially the private services, are exorbitantly high. ठीक है? So Supreme Court has asked the government that why, what are you doing to regulate the private healthcare facilities का cost? If you do not have an answer to this question, India should directly implement the clinical establishment rules, and it will be implemented uniformly across all the states. ठीक है? This is what Supreme Court has stated. So for all of this reason, this is running into news apart from the survey that has published its report. Okay? Now, if we are able to tackle the affordability wala problem of healthcare, what will be the advantage? Okay? If we are able to ensure that healthcare services are affordable, what are the advantage? First major advantage will be improving the access to healthcare. Lancet study reports that India is ranked as 145th country out of 190 countries in quality and accessibility of healthcare services. तो अगर हम लोग इसको अफोर्डेबल बना पाएंगे, हेल्थ केयर फैसिलिटीज बिकम अफोर्डेबल, तो वी विल बी एबल टू इंक्रीज एक्सेस और एक्सेसिबिलिटी ऑल्सो. पीपल आर नॉट गोइंग टू हॉस्पिटल. फॉर एग्जाम्पल इंस्टीट्यूशनल डिलीवरी, क्यों नहीं जाते लोग हॉस्पिटल में इंस्टीट्यूशन डिलीवरी के लिए? व्हाई डोंट पीपल गो टू हॉस्पिटल? Because they think, why should I be spending money in hospital if the midwife can carry out the delivery at home itself? So they don't go to hospital. ये affordability का question है which affects the accessibility also. So if we ensure that healthcare services are affordable, it will automatically turn out to become accessible also. ठीक है? Second is improved health outcomes, early detection and treatment of diseases. तो अगर हम लोग हेल्थ केयर सर्विसेज को अफोर्डेबल बना पाए, सो इन स्टेज 1 ऑफ अ पर्टिकुलर डिजीज द पर्सन विल रिपोर्ट टू द हॉस्पिटल. इफ द स्टेज 1 itself they have reported to the hospital, तो मे बी ड्रग्स से ही, मेडिसिन से ही द पर्सन कैन रिकवर. इफ स्टेज 1 में they have not reported, stage 2 में they have entered, तो मे बी इंजेक्शंस would be required. If then also they have not reported, stage 3 में they are reporting, then amputation may be required, surgery may be required. तो इसका मतलब कि अगर हम लोग हेल्थ केयर सर्विसेज को, इफ गवर्नमेंट ऑफ इंडिया इज एबल टू एंश्योर दैट हेल्थ केयर सर्विसेज इन इंडिया बिकम्स अफोर्डेबल, इफ अफोर्डेबिलिटी इंक्रीज कर पाएंगे, तो वी विल बी एबल टू कैरी आउट अर्ली डिटेक्शन ऑफ डिजीजेस एंड ट्रीटमेंट कैन बी आल्सो बी कैरिड आउट. प्लस ये तो ऑब्वियसली बेटर हेल्थ आउटकम देगा. द पर्सन्स disability adjusted life years will also increase. This person will able to productively contribute to the country's development. But apart from this will also reduce the cost of treatment. You imagine a person who is suffering from simple diabetes, ठीक है? The stage 1 में the person, because diabetes के लिए blood glucose test कराना होता है, and that is very cheap in India. So the person conducts the test और immediately जाके डॉक्टर को consult कर लेते हैं. Now you imagine कि if 1000 rupee was the blood test charge and 5000 rupee was the consultation charge, ठीक है? Or if it is very high, तो obviously the person will not report to the doctor in stage 1. तो इसका मतलब stage 1 में did not report, मतलब diabetes का condition will try to escalate. Stage 2 आते आते maybe let's say insulin injections were required. Again the individual did not report to the hospital. Stage 3 आते आते we are into a stage wherein amputation of one of the organs would be required. ठीक है? तो ये कॉस्ट ऑफ ट्रीटमेंट को भी बढ़ाते चला जाता है. इफ द डिजीज इज नॉट ट्रीटेड इमीडिएटली, द कॉस्ट ऑफ ट्रीटमेंट आल्सो टेंड्स टू इंक्रीज. प्लस it also if we are able to ensure कि health care services are affordable in India, we will also be able to decrease the burden of illness. ठीक है? Next advantage is reduction of financial burden. It will also reduce the financial burden. ठीक है? So reduced high out of pocket expenditure, जो कि हमारे यहाँ अभी approximately 40% के आसपास है. So this will reduce the financial burden on the individual and also increase the personal disposable income. Personal disposable income बढ़ गया, इसका मतलब you can either go for savings and investment वाला cycle leading to development, or can also invest in education leading to growth. ठीक है? So basically we will be able to pull the population out of poverty by increasing their personal disposable income. The entire discussion of universal basic income, it's all not even required if we are able to ensure healthcare services. तो ये required भी नहीं होगा. ठीक है? Then talking about social justice, it will also help us to ensure social justice by providing universal healthcare and publicly funded health systems. Now हमारे DPSP का ये intention है कि sick, disabled, unemployed, इन सब का ख्याल रखना है. DPSP also talks about mother's nutrition, child nutrition and care. ठीक है? So ये सब कुछ fulfill कर पाएंगे if we are able to ensure that healthcare services in India become now affordable. ठीक है? So what has government done in this regard? First major step is of course Ayushman Bharat. Ayushman Bharat has two major components. One is Jan Arogya Yojana and the other one is Health and Wellness Center. जन आरोग्य योजना is the one that we are talking about कि इसमें कार्ड दिया जाएगा आपको, and as a BPL population only, and the card will be provided, and this card you can go and swipe in any of the healthcare facilities including public and private. But private maybe there is a list of hospitals, you can go to any of these hospitals for secondary care and tertiary care. मतलब outpatient department, for example if you have cough and cold, BP, sugar, मतलब anything has spiked and you are going to the hospital and coming out immediately. So for such kind of OPD care services, Ayushman Bharat card will not work. You will have to make use of Ayushman Bharat card only for secondary and tertiary care. ठीक है? So and इसके लिए the money will be credited to the hospital facility from the government itself. So government is actually paying for the health insurance of that individual. ठीक है, approximately 99% of the premium amount is paid by the government itself. ठीक है, and health and wellness center में क्या करेंगे कि this will be an area where you can go for yoga or through food, through changing your lifestyle, through exercise, through meditation, you will be able to improve your health condition. That is the intention of health and wellness center. ठीक है, second initiative is Pradhan Mantri Swasthya Suraksha Yojana. Pradhan Mantri Swasthya Suraksha Yojana talks about enhancing the tertiary care और मेडिकल एजुकेशन सिस्टम को स्ट्रेंथन करने की जरूरत है by setting up new aims. ठीक है, then we have the Jan Aushadhi scheme. Jan Aushadhi scheme is talking about providing generic medicine. Generic medicine is basically a copy paste of the original patented medicine. So generic medicine, quality generic medicine shall be provided at affordable prices and at all such Aushadhi centers. ठीक है, then National Digital Health Mission. National Digital Health Mission talks about health ecosystem through Health ID and National Digital Health Infrastructure. So Digital Health Mission के तहत we will be digitizing the health related information of an individual. So ये जो करना होता है कि एक हॉस्पिटल जाने से पहले सारा फाइल लेके गए, all of this will be removed. So there will be a digital database of every individual in the country. That is the intention of National Digital Health Mission. ठीक है, so this was government initiative to reduce healthcare expenditure. Now what can be the suggestive step? That we need to implement Niti Aayog's action plan for health. This can be one of the suggestive steps. कि नीति आयोग ने suggest किया था that government first of all has to increase the expenditure GDP as a percentage of GDP, जो कि currently 2.1% है, ये बढ़ के 1.6% से बढ़ के 2.1 हुआ है. This we need to pull it up and go up to 3%. ठीक है, and we need to also prioritize preventive care rather than curative care. Preventive care मतलब vaccination बढ़ाने की जरूरत है. Preventive care मतलब you have to ensure कि a person should not suffer from diabetes, should not suffer from cardiovascular diseases. आप खाने का सिस्टम ऐसे बढ़ाओ. For example, नेशनल न्यूट्रिशन मिशन से, नेशनल मिलेट मिशन से मिलेट का कंजम्पशन बढ़ाओ so that कि ब्लड कोलेस्ट्रॉल कम हो जाए, डायबिटीज कम हो जाए, सेडेंटरी लाइफस्टाइल से बाहर निकालो, फिट इंडिया पे फोकस करो. सो इफ यू आर फोकसिंग ऑन प्रिवेंटिव केयर, तो क्यूरेटिव केयर में जो भी इन्वेस्टमेंट होगा वो काफी ज्यादा होगा. प्रिवेंटिव केयर का इन्वेस्टमेंट विल बी क्वाइट लो. ठीक है, so we need to prioritize preventive care rather than curative care. Second is rationalization of healthcare rates. So rationalization of healthcare rates especially for private sectors. Private sectors के लिए let's say कि you cannot put a standardized rate, but at least we can put up a cap. Where does the cap roots from? This comes from the clinical establishment rules of 2010. ठीक है, इसको inflation adjust करके आप current cap बना सकते हो with respect to every state. Then talking about the National Commission for Healthcare Cost Management. National Commission for Healthcare Cost Management का सिर्फ इतना काम रहेगा that they will be recommending कि इसका cost इससे ज्यादा नहीं होना चाहिए. They should be recommend for spending in healthcare and monitor the performance. कि let's say कि आयुष्मान भारत में आपने इतना इन्वेस्टमेंट किया है, so have we been able to see better health related outcomes? ये सब का assessment करेगी National Commission for Healthcare Cost Management. And of course we need to shift towards a universal health coverage. This is actually very important कि every Indian should be secured कि अगर कि because of the government my health is all safe. This is called as universal health coverage. अभी जो आयुष्मान भारत का कार्ड स्कीम लाया गया है, this is covering the BPL population. We need to cover entire population in such kind of health insurance facilities. ठीक है, so this is of course a very long term measure. We need to increase investment at the first instance. तो but ultimately हमारा ये aim होना चाहिए that we should be reaching up to universal health coverage. ठीक है, so these can be some of the suggestive steps that can be mentioned in healthcare, increasing the healthcare affordability, ensuring कि affordable हो पाए healthcare services, which will ultimately ensure कि healthcare services available भी हो पाए, accessible भी हो पाए. ठीक है, now talking about the next topic, which is the Indian Himalayan region towns, IHR towns. ठीक है, why are we discussing about this is because recently Supreme Court has halted a 90-acre project in Kumaon Himalayas. स्टेटिंग दिस फैक्ट कि आप सिंगल विंडो क्लियरेंस के नाम पे कुछ भी प्रोजेक्ट को अप्रूव करते चले जा रहे हो, ठीक है. सो सुप्रीम कोर्ट हैज halted this project कि you cannot proceed with this project. Second is Supreme Court has questioned the central government कि आपका क्या suggestion है. Whatever happened in Joshimath, whatever happened in Uttarakhand floods, whatever is happening in landslides, earthquake and all that in all Uttarakhand या हिमाचल प्रदेश वाले region में ये जो भी problems हो रहे हैं, इसके लिए what is your suggestive solution? What are the steps that you are taking? If you do not have a solution, मतलब you should be recommending some kind of restorative solution for Himalayan ecosystems, ठीक है. Where are these incidents coming from? What is the Supreme Court talking about? ये सारे incidents मतलब क्या incidents आते हैं? It includes the Uttarakhand floods, it includes the Joshimath crisis, land subsidence crisis, it includes the floods which has taken place in Sikkim this year 2024. It also includes the glacial lake outburst flood which took place in Sikkim last year, and the breaking of the Teesta bridge in 2023. Then Silkiara tunnel collapse. ये सबको include करके Supreme Court has asked this question that what is the agenda of the government in Himalayan region, ठीक है. You should be having some kind of some agenda कि इसके बाद I will not be carrying out any construction activity because Himalayan ecosystem is very much vulnerable. Now talking about the significance of this region, there are so many significance and we will not be covering so for example security के terms में भी ये important है Himalayas हमारे लिए, environment के terms में भी important है, economics के भी terms में important है, but we are discussing about only the environmental part, ecological significance of this region. First of all, this is considered to be the water tower of South Asia, and this is not only India, this is the entire South Asia. पूरे South Asia के लिए source of water is Himalayas, ठीक है, including Bangladesh, including Nepal, including Bhutan, including India, including Pakistan. So for all these countries, this is the water tower, ठीक है. Plus, this is also the earthquake coming under earthquake zone 4 or zone 5. This is coming under earthquake zone 4 or 5. What does it mean? Earthquake zone 4 or 5 means it is very much prone to earthquake. We can witness earthquake in this region any time. ठीक है. Why is it so? Because India or Indian plate and Eurasian plate is converging at this point, which is also one of the principal reason for construction of Himalayas, formation of Himalayas for that matter. ये जो young fold mountain बना है, that is because Indian plate is moving towards Eurasian plate and the plate is getting subducted और ये जो curve उठते चला गया, ये पूरा Himalayas बनते चले गए, ठीक है. Now because this is the converging point of two plates, so this is an earthquake zone 4 or zone 5 in earthquake map, ठीक है, seismic map. Talking about the next ecological significance, which is it drives and determines the monsoonal clouds in India. Of course, कि हमारे यहाँ monsoon it enters into India via one is the Bay of Bengal branch, तो जो ऐसे करके ऐसे आती है, ठीक है. One is the Arabian Sea branch जो कि ऐसे जाती है, ठीक है, जो कि western part of western Ghats में बारिश लेकर आती है. Plus we have the Bay of Bengal branch which meets the Arkan Yoma mountains in Myanmar and turns towards this, in this way it turns towards और यहाँ जाके bifurcate हो जाती है. So it goes up to via Bangladesh, it enters, hits the Himalayas and gets bifurcated. One belt moves towards Bihar and then UP and reaches up to Delhi, and the other belt enters into India's northeast. So ultimately it is the Himalayas which is deciding the direction of monsoonal winds in India. So it drives and determines the monsoonal clouds in India. Fourth is the biodiversity hotspot. We know so many hotspots, we know so many protected areas, Nanda Devi, Kanchenjunga and Manas, matlab majority of India's biodiversity hotspots or protected areas are lying in this zone, ठीक है. So this is also responsible for ensuring that the entire ecology, the entire system remains healthy, ठीक है. Plus then strategic and economic significance भी है. Economic significance is such that it gives employment, tourism, it gives employment, agriculture, it has good amount of mineral reserves. So there are so many economic significance. Plus strategic significance इसलिए भी है क्योंकि it provides us a secured boundary in India's northeastern region, ठीक है. और India's eastern part में a secured boundary is because of Himalayas, because the terrain is inhabitable and people cannot live or cross over that region. So we are able to ensure this fact कि ये पूरा area secured रहेगा, the boundaries get secured, ठीक है. So this was about the ecological conditions. But what is changing currently? Things are not very stable here. Things are changing. What are the changes? First is 40% of the urban growth has taken place. 40% of the urban growth in Uttarakhand, in Sikkim and all of this region has taken place in the period between 2011 and 12. ठीक है? Secondly, major towns, Srinagar ho gaya, Guwahati ho gaya, they are all facing water supply crisis, including Shimla. There was a point sometime 1 or 2 years back when people from Shimla started requesting that tourists, you please do not come to Shimla because Shimla is facing a major water crisis. So there are cities, Srinagar, it has 2 beautiful lakes. Dal Lake is also in Srinagar. So despite of all of this, Srinagar is facing the water crisis. Or Guwahati, sitting on the banks of Brahmaputra, still facing a major water crisis. So plus apart from this, they are also facing the issues of sanitation, water waste management because of heavy influx of tourists in all of these regions. Third is the Kashmir Valley, excepting Srinagar, there are only 15 officers which is serving approximately 40 urban local bodies in this region. Okay? So Kashmir Valley mein, then the governance also comes to a halt because you have only 15 officers which are serving 40 ULBs in the region. Okay? Excepting Srinagar. Next change is built up real estate in Srinagar. So Srinagar mein real estate development, which was earlier 34 square kilometers, spreading up to 34 square kilometers, has increased up to 60 square kilometers in the same period between 2011 and 21. That means we have carried out heavy infrastructural investment, heavy real estate development in this region, okay, in a short period of time. Then 90% of the liquid waste enters water bodies which are untreated in all of these areas. This is also very much problematic because this will not only deteriorate the condition of existing water bodies, it will reduce the groundwater, it will reduce the water supply, it will pollute the groundwater resources also. Okay? Then, and of course affecting the tourism. Nearly 31% of the households are connected to sewerage systems in Uttarakhand. So that means all the rest 69, all the rest 69% of the households are not connected to the sewerage system. So all of the waste that is being generated in such households in Uttarakhand, all of them will end up into road, or then there will be a new crisis of waste management. Plus, in plain areas, waste management does not become such a big problem because you do have open available areas for dumping, waste dumping. But in hilly areas, it is not possible. All of this dump will enter into forest area and will start degrading the forest area also. Okay? Plus, if we are carrying out deforestation, that means we are barrening the land and adding waste to all of this land, which will aggravate the condition of landslides. Okay? Plus, these regions are also witnessing the growth of invasive alien species, and the glacial lake atlas has been released by one of the organizations from government, which says that 40% of there has been an increase in glacial lakes by 40% in Uttarakhand region. That means glaciers are melting and adding the water to the glacial lake. Now, glacial lake has a natural barrage. Okay? If this barrage breaks down, so all of this water will flood down to the lower riparian areas. This is what is known as the glacial lake outburst flood. This is what has happened in Sikkim in 2023. There will be a glacier, and glacier slowly and gradually keeps adding water to the nearby lake. We call this as the glacial lake. Now, if there is climate change and global warming taking place, that means the glacier will be melting very fast and the lake water addition will be very fast. That means there is more than its holding capacity. The water will be added to the lake and the barrage will break down, and all of this water will flow down to the lower riparian areas. That means this can cause a havoc and flash floods in southern lower riparian areas. This is what has happened in Sikkim, and this is what the organization also says. Glacial Lake Atlas says there is increase by 40%, increase in glacial lake by 40% in Uttarakhand region. That means all of this region will now become vulnerable to glacial lake outburst flood. Okay. So this was about the changing conditions. Now, what are the causes for these changing conditions? One is unsustainable tourism. This is of course very much correct. Although there was a time when ecotourism was being practiced, or there were less number of tourist influx in a particular area, but nowadays there is immense amount of tourist flow. Okay? And this unsustainable tourism and this expansion, continuous and rigorous expansion, real estate development, 6-lane highways, 4-storied, 5-storied hotels at the mountain top, this all becomes an example of unsustainable tourism, such as reckless widening of roads. For example, Chardham Yatra, Chardham project which is planning to build up 4-lane highways connecting Badrinath, Kedarnath, Gangotri and Yamunotri, or setting up large-scale reservoir-based HEPs. Large-scale reservoir-based HEP will hydroelectric power plants. What do we do in reservoir-based plants? We allow the river water to get collected in a major reservoir, and dam will be constructed here. So that means we are collecting the water in this region. इसमें problem क्या होता है कि it leads to silt deposition, it reduces the flow of marine animals or fresh water based animals. ठीक है? This has also affected India में gangetic dolphins का population. ठीक है? So this is one of the existing problems related to reservoir based HEPs. So what is the alternative solution? Alternative solution is diversion based HEPs. Diversion based HEPs matlab instead of accumulating the main river here, we allow the river to get diverted. Okay? So the main river will be allowed to flow, but some amount of water will be taken away and the dam will be constructed. We call this as diversion based HEPs. Inka ecological repercussion is quite low. Okay? But khair, abhi to we are setting up large scale reservoir based HEPs, and then accumulation of black carbon. Accumulation of black carbon because of vehicular pollution, PM 2.5 or PM 10, all of this getting accumulated and all of this getting deposited on the snow. Okay? This leads to a situation wherein, because they are blackish in color, so they reduce the reflective capability of the snow, plus they also absorb heat. And by absorbing heat, all of this heat is added to the snow-capped region. So that leads to glacial melting and can lead to flash floods also. So overall, it leads to increased flow of water in the rivers. Okay? So there is accumulation of black carbon which has major environmental repercussions. Okay? So this is one of the cause for these changes taking place. Second is the rapid urbanization which is ongoing. Rapid urbanization matlab कि as we discussed कि पहले 30 square kilometer में ही श्रीनगर फैला हुआ था. The real estate development was approximately around 30 square kilometer, but this has increased to 60 square kilometer. So this rapid urbanization is also one of the principal cause for this kind of changes which are taking place in Uttarakhand or Sikkim or Himachal Pradesh or Jammu and Kashmir. Okay? Then of course is the poor planning, because we are not able to control the tourist influx or outflux. We are not able to carry out controlled movement of people because of poor planning, or because of not giving sufficient importance to environment in such vulnerable areas. This has also led to occurrence of such kind of landslide or flash floods in the region. Okay? Understaffing is another problem. For example, Jammu Kashmir mein, as we saw, only 15 officers serving for 40 ULBs is also one of the major problems. That the core area ka problem, which is different for different areas, cannot come up. Okay? Then of course, the problem is that of climate change and the natural causes. For example, the soil quality. The soil quality which is very turbulent, or any slight addition of water can allow easy landslide to take place in all of this region. So there are natural causes also which is responsible for occurrence of all such kind of disaster. Okay? So what are the government initiatives? Government initiatives in this region includes National Mission for Sustainable Himalayan Ecosystem. Sustainable Himalayan Ecosystem intends that we will be ensuring that whatever resources we are extracting from Himalayan region should be sustainable only. But we need to ensure that the Himalayan ecosystem continues in its original form. It shall not be destroyed. That is the intention of National Mission for Sustainable Himalayan Ecosystem. Second is Indian Himalayas Climate Adaptation Program. So Indian Himalayas climate adaptation program mein we are changing, or rather capacity building is being carried out, training is being carried out. How do you change the agricultural pattern to adapt to the situation that Indian Himalayas are changing, the climate is changing, ठीक है. So agriculture में changes, adaptation changes आएंगे, water consumption में adaptation related changes आएंगे, house construction में adaptation related changes आएंगे. So these changes are being introduced amongst the population under this program. Then we have the Secure Himalayas project. Secure Himalayas project is a very important project from Global Environment Facility. Global Environment Facility is one of the international organizations, one of the principal organizations, which is a funding authority only. This will be only funding authority, but ये किनको fund करेगी? जो भी UNEP बोलेगी, United Nations Environment Program, if they say that GEF, you go and fund this organization, this program, this initiative in this country, they will go and do it. So UNEP has directed GEF to fund India's Secure Himalayas project. Secure Himalayas project talks about sustainable management of alpine pastures and forest. Okay. Then we also have National Action Plan on Climate Change, which has one of the plans as restoration of Himalayan ecosystem. Okay. Apart from this, we have an international initiative of HKH, Hindu Kush and Himalayan region also. HKH is an aggregation or congregation of all those countries which are lying in Hindu Kush and Himalayan region, including India, including Bhutan, Bangladesh, some parts of Myanmar also, China also, Pakistan also, Afghanistan also. All of these countries which are responsible for affecting the climatic condition of Hindu Kush and Himalayan region, they have created a separate grouping. Okay? Or if we talk about suggestive solutions, we can also mention about India should learn from practices of Bhutan. How have they ensured that sustainability in development can be carried out? For example, one of the projects of Bhutan is the GMC, Gelfu Mindfulness City, in which they have ensured that this entire industrial area will be carbon negative or carbon neutral at max. Okay? So that means Bhutan has given this kind of example. By execution, they have given this example that industrial corridors can also be set up keeping sustainability or environment at the most important point of discussion. Okay? But apart from this, India should also be carrying out vulnerability mapping. कि landslide में these areas are more vulnerable. Rainfall के time में these areas में we should be more cautious. ठीक है? This area में large scale deforestation cannot be carried out. This area में deforestation can be carried out. The 4-lane highways is not okay. 2-lane highways are fine. ठीक है? Are okay. मतलब executable. So इस तरीके का एक vulnerability mapping करने की जरूरत है. Second is involvement of locals, and this is very important. Very, very important, because it is only and only the locals who understand कि उस जगह का geography क्या है, उस जगह की economics क्या है, what has been the history, what is it leading to. So until and unless you do not involve the locals, we are not able to understand the geography and economics of a particular region. So we must ensure that locals' input must be present in any kind of decision making or policy making which is taking place in this region. Okay? Then we also need to shift focus towards sustainability and climate resilient design. For example, eco-centric approach of development. We need to prioritize EIA, that is environmental impact assessment. Okay? We also need to improve urban finance mechanism. Urban finance mechanisms in ULBs will ensure that they are independent decision making bodies for whatever decisions that is being taken place in their area. Okay? अभी ULBs का in general India, and this is not the problem of only ULBs for that matter, पंचायती राज institutes का भी more or less same ही condition है. The overall third tier of governance has not been able to generate sufficient amount of revenue, financial capability and financial autonomy. ये failure state finance commission का भी हो सकता है. This is the failure of the ULBs and PRIs also, but ultimately this is the fact that they have not been able to generate sustainable revenue out of them. They earn nearly 1% of their total expenditure. 33% coming from state government and rest is coming from central government. So they are not able to generate revenue and they are consuming some amount of money. This is not expected from a governance model. Okay? Then we also need to carry out bioculture conservation zone. Bioculture conservation zone क्या करेगा कि दिस विल बी अ कंजर्वेशन जोन, ठीक है। इसमें बायो कल्चर किया जाएगा, मतलब वी विल बी इंप्रूविंग द बायोलॉजी ऑफ अ पर्टिकुलर रीजन. We are not ensuring that we are not taking any action. We need to take positive steps to ensure that the biology of a particular region continues to improve, ठीक है. So इस तरीके का बायो कल्चर कंजर्वेशन जोन्स वी हैव टू क्रिएट एंड this should be having, it must be having, ये सुप्रीम कोर्ट का भी कहना है that all of this entire Himalayan region should have a separate EIA and there should be a separate body or organization which should be ensuring and regulating the implementation of EIA in this region, ठीक है. So environmental impact assessment should be carried out. Environmental impact assessment का क्या कहना होता है कि we need to assess कि आप ये जो प्रोजेक्ट चला रहे हो, be it roadways, highways, railways, टनल के बीच से रोड निकाल रहे हो या रेल निकाल रहे हो या 6 स्टोरीड टूरिज्म का प्रोजेक्ट बना रहे हो, इन सभी प्रोजेक्ट में डेवलपमेंटल प्रोजेक्ट विल हैव सम काइंड ऑफ एनवायरमेंटल इम्पैक्ट. So we assess this impact to find out कि कोई ऑप्शन है, is there any option to reduce the environmental impact? This EIA is a norm in India. We do have rules related to EIA implementation. We need to implement the EIA for entire northeastern, entire Himalayan belt in India. और इसके लिए one single common body should be existing. This body should ensure that EIA implementation is being carried out in all the states. ठीक है? Then structural solutions for mitigation of GLOF is also required, or structural solutions for mitigation of landslide is also required. What do we mean by structural solution? We basically mean कि आपको for example barriers create करने पड़ेंगे so that if the water is flowing down, so it should be getting diverted, it should get diverted and it should not get concentrated in a particular region which can cause havoc or disaster. So is the case with landslide or mud flow also, कि अगर ये landslide is taking place, so you should also ensure that it should get diverted so that the places where human habitants, मतलब the places where people are residing, all of that region should not get affected. ठीक है? This is also one of the adaptation mechanism, but structural solution at least ensures कि loss of life and property नहीं हो. ठीक है? So with that we come to the end of this topic and the current affairs, major mains part current affairs of last week. ठीक है? If you have any doubt, please do let us know in the comment section. I wish you all the very best and thank you so much.
Thank you.